You know, we know that 5,500 people are dying from alcohol every year. We know 157,000 people are being hospitalised because of it. It costs $15 to $30 billion a year of taxpayers' money for healthcare systems and police and ambulance and those sorts of things. So we can't just rely on just one section of the community to do something. We need to bring people together, and one, they need to understand the issues. And drug action teams and community drug action teams are perfect places of getting people together to understand what the issues are about and then looking at what they can do about it. With alcohol, it's really important that we understand that the evidence has told us if we do something about availability, you know, where can I get it, and how many places I can get it from, and we do something around marketing, the advertising of it, and we do something around pricing, that we know, even if you can see it translated in what we've done around tobacco, we know we will have a major impact on reducing the harms around alcohol-related disease and death. So these are three things that a CDAC can confidently look at and start working on. So let's look at availability, number one. So how many places have liquor license? How many liquor licenses are there in your neighbourhood? How do they get enabled to happen? Do you actually oppose those liquor licenses? Have you thought about what's the process around that? And we do have some toolkits around those sorts of things. You know, so how many bottle shops do you have? How many licensed restaurants do you have? All of these sorts of things. There's huge amounts of evidence out there on what you can be looking at and the things that you could be thinking about. And will you fight when McDonald's wants to have a liquor licence put in? Will you think about that? Will those sorts of things come to the register of the CDAC? So availability is one thing. You know, we have 15,000 liquor licences in New South Wales alone. It's really quite interesting that alcohol is seen very much as we cannot do anything in our life without alcohol being present. Now we have to show and role model and behave around the fact that we can have fun with alcohol, and CDACs need to do that as well. 70% of the purchases of alcohol are through bottle shops. So bottle shops, or takeaway, or off licences as they're known, are equally as important to look at as on licensed premises. So don't just think of the big barns, don't just think of the big nightclubs. Also understand that alcohol can be sold in many different places. I often talk about it takes a village, and you know, it's a bit hackneyed and we have said this sort of stuff quite a lot, but it does take a village. The power of one is really important, and one person can make a difference. But imagine all these individuals coming together to look at an issue, the power of that, and the power of what a village will take to make change happen. So I think it's really important that CDACs understand that they can't do this on their own, that they need to be looking out there at who they can partner with, who can they talk with, who can they learn from, who can they get on board to help with the issues. And that's people like, you know, other health services, it's like education services, police, ambulance, government, local government, sporting clubs, neighbourhood houses, local learning centres, a whole raft of different things. Who's in your community that you can work with and get on board about these things? But don't forget, you need to be really clear about why you're doing what you're doing, and you need to understand the fundamentals of what's happening in your community. So what's your issue in your community? Find out about that. Use statistics, talk to people, hear what's happening, read the local papers. You need to understand, and then you need to test whether that is accurate. The other thing is, don't think it has to be big. I think that's the important thing. Sometimes we think it has to be really huge to make an impact, and it may not be. It may be that you're writing a regular column in the newsletter or in the newspaper, and that you're actually sort of raising those issues, and you're constantly raising that issues. And then you might reinforce that with an event or something to keep reinforcing that. So that's not huge. It takes a bit of time each week to do something like that, but it can have great effect. At least raising the issue and getting everyone talking about the issue is one of the first steps. But don't let it get you down. Sometimes you'll have wins, sometimes you won't, and especially around liquor licensing. That's a hard road, but we're there to support you, and there's others to support you. But join in the fact that, you know, there's other groups out there who are trying to do the same things, and hopefully you can learn from each other and work together as well.